Hi everyone. So let's address another very important elephant in the room. So it's the peripheral vascular examination of the upper limb. A few things is important when you want to do this examination. So the very first thing you want to do as you're about to examine is to ask the patient to wiper plus IPPA. So once you've done that, during the inspection, you want to look for scars, loss of hair, hyperemia, and things like that. So once you've done that, the very first thing you want to do, you want to ask the patient to do like this, and you want to feel the temperature, differential warmth. Then you want to assess for capillary refill bilaterally. Now you want to feel for relevant pulses. So you want to start with the radial pulse, and then you want to do both radial pulse at the same time for radial delay. This is not how to do it, so it'd be two hands like that. You feel one pulse and the other one. So feel both radial pulse for radial delay. Once you've done that, you want to go up here and feel for the brachial pulse. Once you've felt for the brachial pulse, you feel also for the other one, both of them. Now, once you've done that, you want to quickly go up here to feel to assess the carotid pulse. But generally, because of the prevalence of carotid artery stenosis, you want to assess for a brew first. So you use the bell of the diaphragm and you ask the patient to take a deep breath, and then you feel for a brew. If you don't feel any brew, you can go ahead and now palpate the carotid pulse bilaterally. Good. So once you've done that, you now want to go down to the abdomen. The first thing you want to do, you want to inspect the abdomen. But in the peripheral vascular exam, your focus on palpation is to try and palpate the abdominal aorta. So you want to come to the middle and do something like this. You want to palpate, the patient is lying down. You want to try and dip in. Usually in slim patients like myself, it's easier, and then you can assess for pulsatility or expansivity. So either pulsatility like this, or whether it's expansile, therefore it's doing this movement. And pulsatility is doing that movement. So with that done, you want to go ahead and auscultate as well. You want to auscultate along that line. You want to auscultate along that line, and you also want to auscultate in the area of the renal arteries, which is usually 2 to 4 cm lateral and above, like that. Now, once you've done this, you want to, usually this would conclude the vascular examination, peripheral vascular examination of the upper limb. Thank you for listening. So let's quickly recap. So you assess you ensure wiper and IPPA, you assess temperature, capillary refill, and pulse. And the pulses, you assess the radial pulse, brachial pulse, as then you assess the pulses in the neck, and you assess radial delay. Then you you go to the abdomen, you inspect, palpate, and auscultate. Thank you for listening. Please subscribe, like, and follow the channel.